This one food mistake could be the reason you keep getting urinary tract infections again and again, even when you drink enough water and follow basic hygiene. If you've ever suffered from burning while urinating, constant pressure in your bladder, or painful bathroom trips that interrupt your sleep, then this video is something you need to hear carefully, because the meat I am about to talk about is eaten by millions of people every single day without realizing the silent damage it may be causing inside the urinary system. And before we break this down fully, make sure you subscribe to this channel, because the information you're about to hear could save you from years of recurring discomfort and unnecessary antibiotics. Urinary tract infections are often blamed on poor hygiene, dehydration, or weak immunity. But very few people are told that diet plays a massive role in triggering and worsening UTIs. Among all foods, one type of meat stands out for its strong connection with harmful bacteria that directly attack the urinary tract. Processed meat and improperly handled poultry are among the most common hidden contributors. These meats often carry dangerous bacteria like E. coli, which is responsible for nearly 80% of urinary tract infections worldwide. When this bacteria enters your digestive system, it doesn't always stay there. It can migrate from the gut to the urinary tract, especially in people whose immune systems are already under pressure. What makes this situation worse is that processed meats are often treated with preservatives, sodium, and artificial additives that disturb the balance of good bacteria in your gut. Once this balance is disrupted, harmful bacteria grow faster, multiply aggressively, and become more resistant to your body's natural defenses. This creates the perfect environment for repeated infections. Many people don't realize that every time they consume contaminated or heavily processed meat, they are feeding the very bacteria that later shows up as pain, burning, and inflammation in the urinary tract. Chicken, especially factory-farmed chicken, is one of the most commonly contaminated meats. Studies have shown that antibiotic-resistant strains of E. coli found in chicken meat are genetically similar to the strains found in UTI patients. This means the bacteria doesn't just randomly appear, it often comes directly from food. When chicken is undercooked, cross-contaminated in the kitchen, or consumed frequently without proper gut protection, it significantly increases the risk of infection. Red meat that is processed, cured, or stored improperly carries similar risks, especially when consumed daily. Another major problem is antibiotics used in meat production. Animals raised for meat are often given antibiotics to grow faster and survive crowded conditions. These antibiotics don't disappear when the meat reaches your plate. Over time, consuming such meat trains bacteria inside your body to become resistant to treatment. That's why many people experience UTIs that keep coming back and stop responding to common antibiotics. The infection becomes harder to treat, lasts longer, and causes more damage to the bladder and kidneys. Women are especially vulnerable because of shorter urethras, but men and seniors are not immune. In older adults, repeated UTIs can lead to confusion, fatigue, and serious kidney complications. In people with diabetes, the risk is even higher because high blood sugar feeds bacteria and weakens immune responses. The scary part is that most people focus only on medication and ignore the root cause sitting quietly in their daily meals. Now here's where things get even more concerning. Processed meats also cause inflammation throughout the body. Chronic inflammation weakens the lining of the urinary tract, making it easier for bacteria to attach, invade, and multiply. Once the bladder lining is damaged, even a small amount of bacteria can trigger a full-blown infection. This is why some people feel symptoms immediately after eating certain foods, even if they were fine just hours earlier. But the good news is this cycle can be broken. Preventing UTIs doesn't require extreme diets or expensive treatments. It starts with awareness and smarter food choices. Reducing or completely avoiding processed meats is one of the most powerful steps you can take. Choosing fresh, clean, properly cooked protein sources dramatically lowers bacterial exposure. Organic or antibiotic-free poultry, when handled correctly, is far safer than mass-produced alternatives. Supporting your gut health is equally important. A healthy gut acts as a barrier, preventing harmful bacteria from spreading to other parts of the body. Including probiotic-rich foods helps restore balance and strengthens your natural defenses. When your gut bacteria are strong, harmful strains like E. coli struggle to survive. Hydration also plays a crucial role. Drinking enough water flushes bacteria out of the urinary tract before they can settle and multiply. Certain foods naturally protect the urinary system. Cranberries, for example, contain compounds that prevent bacteria from sticking to the bladder walls. Garlic has natural antibacterial properties that fight infection without harming good bacteria. Vitamin C increases urine acidity, making it harder for bacteria to grow. These small dietary additions can create a powerful defense system when combined with clean eating habits. Cooking methods matter more than people realize. Always cook meat thoroughly, avoid cross-contamination in the kitchen, and never store cooked meat for too long. Simple hygiene practices, like washing hands, cleaning cutting boards, and separating raw and cooked foods, can significantly reduce bacterial exposure. What seems like a minor kitchen habit can decide whether bacteria enter your body or not. If you're someone who suffers from frequent UTIs, this is your wake-up call. Medication alone is not enough if the source of infection keeps returning. Real healing happens when you remove the trigger and support your body naturally. Many people notice dramatic improvements simply by changing their protein sources and focusing on gut health for a few weeks. Urinary tract infections are painful, frustrating, and exhausting, but they are not always unavoidable. Sometimes, all it takes is removing one harmful food habit and replacing it with smarter choices. The meat you eat daily could either be feeding harmful bacteria or fueling your body's defense system. The choice is yours, and now you have the knowledge to choose wisely. The real danger begins when these infections don't stop at discomfort and pain, but slowly start changing how your body reacts over time. Repeated urinary tract infections weaken the bladder lining, making it thinner, more sensitive, and easier for bacteria to attack again. This is why some people feel symptoms after eating certain meals, especially meat-heavy dinners. The body remembers the damage. Each infection leaves behind microscopic scars, and every time harmful bacteria enter again, they find less resistance than before. This creates a vicious cycle where UTIs become more frequent, more painful, and harder to treat. What most people don't realize is that meat-related UTIs are not always caused by eating meat itself, but by how modern meat is produced, stored, and consumed. Factory farming conditions allow bacteria to thrive. Animals live in crowded spaces, exposed to waste, stress, and repeated antibiotic use. This environment breeds aggressive, drug-resistant bacteria that survive cooking mistakes, kitchen contamination, and even some medications. When these bacteria enter your body, they don't behave like ordinary germs. They adapt, hide, and wait for the perfect moment to attack. Another overlooked factor is how meat affects urine chemistry. High intake of certain meats increases urine acidity and nitrogen waste, which can irritate the bladder lining. An irritated bladder becomes inflamed and sensitive, making it easier for bacteria to stick and grow. This is why some people notice burning or pressure even before a full infection develops. The bladder is already under stress, and bacteria simply take advantage of that weakness. Processed meats make this situation far worse. Sausages, deli meats, cured beef, nuggets, and frozen meat products are loaded with sodium and preservatives. Excess sodium dehydrates the body at a cellular level, even if you think you're drinking enough water. Dehydration means less urine flow, and less urine flow means bacteria stay longer in the urinary tract. The longer they stay, the stronger they become. This is one of the biggest reasons UTIs often flare up after heavy salty meals. There is also a hormonal angle most people never hear about. Diets high in processed meat can increase inflammation-related hormones in the body. In women, this can disrupt the natural protective environment of the urinary tract, especially during menstruation, pregnancy, or menopause. In men, inflammation can affect the prostate, slowing urine flow and allowing bacteria to remain trapped longer. In both cases, the result is the same, higher infection risk. And here's something truly alarming. Some strains of E. coli linked to meat don't cause immediate symptoms. They quietly colonize the gut first. Weeks or even months later, under stress, dehydration, or low immunity, they travel to the urinary tract. This delayed effect makes it hard for people to connect their UTIs with food habits. They blame weather, stress, or weak bladder, while the real cause continues in the background. Now let's talk about why antibiotics alone often fail. Every time you take antibiotics for a UTI, they kill both bad and good bacteria. While symptoms may disappear temporarily, the protective bacteria that keep harmful germs in check are also wiped out. If your diet continues to reintroduce the same bacteria through contaminated or processed meat, the infection comes back stronger. This is how people end up stuck in a cycle of treatment, relief, relapse, and frustration. Breaking this cycle requires smarter choices, not fear. You don't have to completely eliminate meat, but you do need to change how you choose and consume it. Limiting processed meat is the first and most powerful step. Choosing fresh, high-quality protein and ensuring proper cooking drastically reduces bacterial load. Avoiding leftover meat stored for long periods is another simple but effective move. Equally important is rebuilding your body's natural defenses. Strengthening the gut means fewer bacteria escape into the urinary tract. Fermented foods, fiber-rich vegetables, and adequate hydration help restore balance. When your gut is strong, harmful bacteria lose their advantage. Supporting the bladder itself also matters. Foods and habits that reduce inflammation give the urinary tract time to heal from past damage. Now let's talk about how you can finally protect yourself and stop urinary tract infections from coming back again and again. The most powerful change starts with awareness, not fear. Once you understand that bacteria thrive on weakness, inflammation, and poor gut balance, you can begin rebuilding your body's natural shield. Your urinary tract was designed to flush out bacteria efficiently, but it needs the right support to do its job properly. Hydration is not just about drinking water, it's about timing and consistency. Drinking small amounts throughout the day keeps urine flowing and prevents bacteria from settling. When urine stays stagnant, bacteria multiply. This is why people who drink most of their water only at night or forget to hydrate during the day face more infections. Adding a pinch of natural electrolytes or lemon can support better absorption and bladder flushing. Food choices can actively block bacteria instead of feeding them. Certain natural compounds make it harder for bacteria like E. coli to attach to the bladder walls. When bacteria can't stick, they get flushed out before causing infection. This is one of the reasons people who include protective foods regularly notice fewer symptoms, less burning, and faster recovery. Over time, the bladder lining becomes stronger and more resistant. Reducing inflammation is another critical step. Chronic low-level inflammation weakens tissue barriers, making infections easier. This inflammation often comes from processed foods, excessive meat intake, and chemical additives. When you replace these with cleaner meals, your body shifts into repair mode. The bladder lining starts healing, sensitivity reduces, and the urge to urinate frequently begins to normalize. Kitchen habits matter more than most people think. Even high-quality meat can become dangerous if mishandled. Cross-contamination spreads bacteria silently. Simple habits like washing hands, separating raw meat, and cleaning surfaces can reduce bacterial exposure dramatically. Many infections don't start inside the body, they start on the cutting board. Another overlooked factor is immunity. Stress, poor sleep, and nutrient deficiencies weaken the immune response. When immunity drops, bacteria gain control. Supporting your immune system with proper rest, sunlight, and nutrient-rich foods strengthens your body's ability to fight infection before symptoms appear. People who fix sleep patterns often notice fewer infections without changing anything else. Holding urine for long periods is another silent trigger. When urine stays in the bladder too long, bacteria get time to grow. Making bathroom habits a priority helps flush out germs regularly. This simple behavior change alone has helped many people reduce recurring UTIs significantly. For those who've suffered for years, patience is key. Healing doesn't happen overnight. The body needs time to rebuild healthy bacteria, repair damaged tissue, and reset its defenses. But the progress is real. Many people notice fewer symptoms within weeks when they remove triggers and support healing naturally. This is why relying only on medication often fails. Antibiotics may clear symptoms, but they don't rebuild protection. Real prevention comes from removing what feeds bacteria and strengthening what protects you. When both work together, infections lose their grip. And this is exactly why you should stay connected with this channel. We don't just talk about problems. We break down causes, expose hidden triggers, and share practical solutions you can actually use in daily life. If you haven't subscribed yet, do it now, because upcoming videos will dive deeper into food, habits, and science-backed ways to protect your health long-term. Urinary tract infections are not just random events. They are signals. Signals that something in your daily routine needs attention. Sometimes, changing one food habit, one kitchen practice, or one daily routine can completely change your health journey. Your body is always trying to protect you. Once you stop feeding the problem and start supporting the solution, healing becomes possible. The choice you make today decides whether bacteria keep winning or your body finally takes control.